Hello everyone. Welcome back to the podcast. Today, we're going to talk about a very unusual and frightening story involving the Hondius cruise ship and a rare disease called hantavirus.
Many people became worried because the situation reminded them of COVID-19 and the cruise ship outbreaks during the pandemic. But what exactly happened? What is hantavirus? How does it spread? Can people prevent it? And is cruise travel safe today?
What is the Hondius? The Hondius is a special expedition cruise ship. It is operated by Oceanwide Expeditions, a travel company from the Netherlands. Unlike normal luxury cruise ships, the Hondius is designed for adventure travel. The ship often travels to remote and icy places such as Antarctica, the Arctic, Greenland. Passengers join these cruises to see penguins, whales, glaciers, icebergs, beautiful snowy landscapes.
The ship can normally carry around 170 passengers. During this voyage, reports said there were about 88 passengers, 59 crew members. So around 150 people were on board. People on the ship included tourists, scientists, expedition guides, nature photographers, crew members, medical staff. For many passengers, this was supposed to be a dream vacation. People pay a lot of money to go on these dream vacations. Tickets usually range from $15,000 to $24,000 per person. But suddenly, people became sick. What happened on the ship?
During the cruise, several passengers began feeling ill. Some people developed symptoms such as fever, headaches, muscle pain, fatigue, breathing problems. At first, many people worried because the symptoms sounded similar to COVID-19. Soon, health officials discovered something surprising. The illness was linked to hantavirus. This virus is rare, and many people had never heard about it before. According to reports, 3 people died. 7 confirmed infections were reported.
Additional suspected cases were investigated. Health officials said the outbreak may involve the Andes strain of hantavirus. This strain is unusual because limited human-to-human transmission may happen. That is why health authorities carefully monitored passengers and crew. What is hantavirus?
So what exactly is hantavirus? Hantavirus is a disease mainly carried by rodents such as mice, rats. People usually become infected when they breathe tiny particles from rodent urine, droppings, saliva. This can happen in places where rodents are present. For example, old buildings, cabins, farms, camping areas, storage rooms. Symptoms may appear between 1 week and 8 weeks after exposure.
Doctors call this the incubation period. Many health officials used a 42-day monitoring period for passengers. After they returned home, early symptoms may include fever, headache, muscle aches, fatigue. More serious symptoms may include trouble breathing, coughing, fluid in the lungs. In severe cases, hantavirus can become very dangerous. Is hantavirus like COVID-19?
Many people asked, is hantavirus another COVID-19? The answer is no. Hantavirus and COVID-19 are very different diseases. COVID-19 spreads very easily from person to person through the air. People can spread COVID-19 by talking, coughing, sneezing.
But hantavirus usually spreads from rodents to humans. Most types of hantavirus do not spread easily between people. That is an important difference. Experts say hantavirus is much less contagious than COVID-19. How can we prevent hantavirus?
Now let's talk about prevention. The best way to prevent hantavirus is avoiding contact with rodents and contaminated areas. Control rodents. Rodents such as deer, mice can carry the virus. People should seal holes and cracks in homes and cabins. Keep food in sealed containers. Remove trash regularly. Clean clutter where mice hide. Use traps if necessary. Clean safely. One very important rule is this: do not sweep or vacuum mouse droppings directly. Why? Because tiny virus particles can enter the air. Instead, open windows first. Let fresh air enter for about 30 minutes. Wear gloves and possibly a mask. Spray disinfectant or bleach solution. Wipe carefully with paper towels. Wash hands thoroughly. Be careful outdoors. Campers and hikers should avoid sleeping near rodent nests. Use tents with floors. Store food safely. Avoid touching dead rodents. Protect workers and travelers.
People cleaning. Old buildings, cabins, barns, ships. Storage areas should use gloves, N95 style masks. Proper ventilation. Simple prevention steps can greatly reduce risk. What happened after passengers returned home?
After leaving the ship, passengers traveled back to more than 20 countries. Many governments quickly began emergency health procedures. Some passengers were quarantined, tested regularly, monitored for symptoms, treated in hospitals. Some people had to isolate for up to 42 days. Countries such as the United States, France, Spain, the Netherlands carefully monitored returning passengers.
Some passengers also experienced emotional stress after being isolated for a long time. Is cruise travel safe today?
Many people still worry about cruise ships after COVID-19, but modern cruise companies now follow strict safety procedures. Cruise ships usually have medical staff, cleaning teams, health screenings, emergency plans, isolation rooms.
Passengers can also help protect themselves by washing hands often, reporting symptoms early, following crew instructions, avoiding unsafe contact with animals. No travel is completely risk-free, but many experts believe cruise travel today is safer than during the early COVID-19 years.
So today we learned what happened on the Hondius cruise ship, what hantavirus is, how it differs from COVID-19, how to prevent infection, why passengers were monitored, and how cruise ships handle health emergencies. Stories like this help us understand both world news and deadly virus.
Thank you very much for listening. Please follow the podcast and share it with your friends. See you in the next episode.